Hello, I hope everyone's doing great today. So today I want to talk to you specifically about menopause and kind of go into the symptoms and maybe some things you can do about it. So obviously, the first thing is to understand what menopause is, and really that's as women go through stages of life. Well, menopause is kind of one of those life phases, if you will. And really what that means is they are no longer menstruating or no longer able to reproduce or bear children. So, normally, a woman has menstruations monthly, really from adolescence to an older age, which we'll cover in a minute. But that's really just normal. Part of being a woman is the normal menstrual cycle. But as they get older, they start to enter menopause, and that's when this cycle starts to end. It also has a lot of effect on different female sex hormones, specifically estrogen and progesterone. These will naturally start to lower as women grow older. So first, what is the causes of menopause? Well, obviously there's the natural menopause that's part of this aging, that is your ovaries start to make less estrogen and progesterone. These are what regulate your menstrual cycle, and these hormones decrease as we grow older. This reduction will continue, and then eventually the ovaries stop releasing eggs, and basically that is what really triggers menopause. But that's a natural menopause. You can also, women have had surgery to remove the ovaries, can put them right into immediate menopause. We'll talk more about that. As with chemotherapy, radiation therapy, that too can put women right into menopause because it makes the ovaries stop working. And the consequences of this, on how rapid a woman enters menopause, we'll talk more about. But traditionally, when we're talking about kind of natural menopause, that occurs really around the age between 45 and 55. Now, obviously, there's extremes of age, but in general, the natural menopause begins after the age of 45. Now, obviously, I'm not talking about the surgical or the chemotherapy-induced ones, because obviously those can happen at any age. But it's also important to understand that about 1% of women may actually be in menopause before the age of 40. This is known as premature menopause or primary ovarian insufficiency. And then another 5% begin menopause between the ages of 40 and 45. And this is known as early menopause. So while we say 45 and older, there is quite a few women that start to enter menopause before that age. So when we're talking about menopause is kind of broken down into 3 stages. And what's important about menopause is that's what causes your ovaries to stop producing eggs. That means you no longer will have periods, and you're no longer able to become pregnant. So the first stage is what's called perimenopause. This is the period when your hormones, they start to change and kind of prepare you for menopause. And during this perimenopause period, your periods will become irregular. They may be late, they may be absent for months, and your flow may be either heavier or lighter. And this stage can really last from just a few months to many, many years, actually. So this perimenopausal phase is one of those things that really by the mid-40s, the women are entering. And it can be prolonged or it can be short, as I said. But the important thing to remember during perimenopause is there's still a chance that you could get pregnant. So obviously safe sex practices would be essential. Now, menopause is the stage where you have menstruation is stopped for at least a year, either related to the menopause itself or whether it's radiation or surgically induced. So menopause is really absence of your period. So that brings us to the third stage of postmenopause. And this is where we talk a lot about the symptoms related to this. And this is really the years after you hit menopause. It can really be challenging though if you're in menopause or postmenopause, because a lot of times the menopausal symptoms can last a long, long time. So during menopause, like we said, your hormones are changing significantly, and it's this hormonal change that really can cause kind of many of the uncomfortable symptoms. Now, the good news is most women don't require treatment for these symptoms, but some do. We'll talk more about the different treatments. But, menopause, the experience of menopause is different in every woman. And so the symptoms can be severe in some women and occur suddenly or last a long time. But also they may not be as severe in other women. So it's really difficult to predict kind of the symptoms of menopause. Now, the one thing we do know is if you have issues that are like the surgery-induced menopause or chemotherapy-induced, something that puts you into menopause rapidly, usually the symptoms are more severe for these people. And then lifestyle choices also aggravate the symptoms, like smoking can aggravate your symptoms. So there's some things you can do to help you with your symptoms of menopause. So some of these symptoms can really impact your quality of life, and some can just be kind of mild nuisances. But really, some of the symptoms that are included here are basically irregular periods. If you have normal periods throughout your life, and then also you start to have irregular periods, that's probably a sign you're entering menopause. And what I mean by irregular, they may be more or less frequent. They can be heavier or lighter, can last longer, be shorter. Just something that's not kind of the normal pattern for you. Now, of note though is, any bleeding, even if it's just mild spotting after menopause, is not normal. And if you have any of these types of symptoms, you really should seek the guidance of a physician. So once you've entered menopause, you should have no vaginal bleeding. Probably the biggest symptom that we hear about is hot flashes or night sweats. That's really where you suddenly feel hot in your upper body for really no apparent reason. Often the sensation will start in your face and your neck and chest and kind of progress upward and downward. Your heart may even feel like it's beating faster. Night sweats are hot flashes that happen while you're asleep, and these can be so intense that they wake you up. And these symptoms vary in severity for every woman, and they can last from 1 to 5 minutes. In addition, you can have several episodes within an hour, 1 per week, or never experience them. So hot flashes, they usually occur within the first year after your period stops, but unfortunately some women experience these for years. Another symptom of menopause is mood change. Menopause can affect your mood, causing you to feel sad, irritable, tired, anxious, depressed. If you have a history of depression or anxiety, menopause may worsen your symptoms. How you feel about menopause can also affect your mood. For instance, worrying about the low libido or end of fertility can worsen menopause-associated depression. In fact, a 2018 article suggested that there may be a link between menopause and suicide. So if you find yourself thinking about suicide when you're going through menopause, you really should seek the help of a physician. And additionally, feeling sad and irritable or tired doesn't necessarily indicate depression, but you should see your doctor if you're feeling down for more than just a few weeks. Another symptom of menopause is vaginal dryness and discomfort. This can start during the perimenopausal stage and really continue through menopause. This is really, the vaginal dryness can result in chafing, discomfort during vaginal sex, and if your skin's breaking down the process, it puts you at high risk for infection. So the thinning and drying and the inflammation of the vaginal wall, this is known as atrophic vaginitis, and this can sometimes occur in the menopausal woman. Another symptom of menopause is urinary incontinence. So the lower estrogen level that comes with menopause may cause your pelvic muscles to get weaker, and this reduces the muscularity or the muscle of the pelvic floor and your ability to control your bladder, and that can result in urinary incontinence. Another symptom of menopause is sleep disturbances. So you may find yourself waking up during the night or having trouble going back to sleep. It may be due to the mood changes, it might be night sweats, might also be increased need for urination. Another symptom of menopause is difficulty in concentrating and learning. In fact, more than 60% of women may experience difficulty with concentration and memory when going through menopause. Another symptom is a lower sex drive. Someone will lose interest in sex or have the trouble getting aroused when they are in menopause. And the vaginal dryness can also make sex painful. So another thing that kind of lowers their sex drive. Well, what are some of the physical changes? Well, there's women as they go through menopause may experience some physical changes around the period of menopause, and some of these include accumulation of abdominal fat. They may gain weight. And they may have a breast reduction or tenderness. They may note a change in their hair texture or color, and they may actually have increased stiff joints. But the important thing to understand here is kind of the association between the changes in menopause. It's not clearly understood, so this can be very vague and also may be a result of other type of concerns. So it's important that you pay attention to what your body's telling you. If you have any questions, I would reach out to your physician to get some guidance. Well, does menopause affect your risk for certain health conditions? Well, unfortunately it does. So, the risk of some health issues appears to increase after menopause. So menopause itself doesn't cause these issues, but the associated hormonal changes may play some type of role. So these health issues include osteoporosis, cardiovascular disease, breast cancer. So how do you manage menopausal symptoms? Well, a lot of the symptoms aren't major health problems, but they can trigger many unwanted physical and mental changes. So if these changes significantly affect your quality of life, you really probably should speak to your doctor because there are some recommendations that they could follow. So the first one could be hormonal therapy. So hormone therapy provides your body with supplement estrogen and progesterone to kind of help balance your body's hormonal levels. This can help reduce the occurrence of hot flashes and other menopausal symptoms. Hormonal therapy is available in various forms, including skin patches, topical creams. However, there is some risk associated with this in developing other health issues. So really you should avoid it if there's any type of family history or personal history of heart disease, liver disease, breast cancer, strokes, blood clots, gallbladder disease, high blood triglyceride levels. These are really things you should consider in when you're looking at hormonal therapy, because there's a lot of things that this hormonal therapy can make worse. So what are some of the other treatment options? Well, there's over-the-counter gels and prescription pills and creams and rings that really help just specifically for kind of the vaginal dryness. You can do low dose of hormonal birth control pills for hot flashes, mood change, and vaginal dryness. You can also do low doses of antidepressants for hot flashes, and this works even on people without depression. You can do things with medication to prevent or treat osteoporosis. This can include calcium, magnesium, and vitamin D, so helping our bone strength. And then some lifestyle interventions that can help with the menopausal symptoms. The first one is exercise regularly. This will help reduce your symptoms of menopause and actually add strength to your bones. You want to maintain a healthy diet. This includes lots of fresh fruits, vegetables, whole grains. Quit smoking is really just straight up as clear as I can say that. Another thing you can do is what's called Kegel exercises, where you basically are strengthening your pelvic floor muscles, and that's going to help with urinary incontinence. In addition to that, you can limit intake of certain things like alcohol, caffeine, hot beverages, spicy foods, things that you find that trigger your hot flashes. You may want to dress in loose clothing or layered clothing, especially during warm weather and nighttime. Try to get good rest, good quality sleep is really important. And then obviously, if you're having problems in the mental health arena, mood changes, relationship problems, I would recommend you seek help for that, because there's things that can be done. And really, the important thing to remember is talking to others around you and expressing how you're feeling and things like that can really be beneficial, because you find that a lot of the symptoms you're having, other people may share in similar experience, and may be able to provide you some help and guidance on how to address those. Now, obviously, since we're talking about menopause, and that means that you're no longer in a period, that means that you can no longer get pregnant. I do want to make a note here that you really should still use barrier protection during sex. is really to protect yourself from sexually transmitted infections. So, just to kind of tie it all up, menopause is usually a natural occurrence. It marks the end of a woman's fertility. And this transition usually happens during midlife, but genetics and certain conditions can cause it to happen earlier. But many women experience these menopausal symptoms, which can start before menopause, continue for years after menopause. But the reality is these symptoms can generally be managed with lifestyle adjustments and really kind of paying attention to kind of what you're doing that may be aggravating, or things you could be doing that can help kind of with these symptoms. But there are some medications that can help also if needed, and I recommend you speak to your healthcare provider about that. So hopefully, this little bit's helped you. If you're a woman that's entering or about to enter this phase of your life, hopefully this helps provide you some guidance, some things to consider, some things you may want to do to improve your symptoms or reduce the symptoms, and also maintain good health. So hope this helps. Just remember, you're on this journey of your health and wellness, and just remember, you've got it. Thanks.